Okay, so for the introduction of Dr. Lisa, so Dr. Lisa Fox-Wright graduated from the Ohio State University College of Veterinary Medicine in 2009. She worked for 9 years at her family's conventional medicine practice, successfully incorporating holistic modalities into appointments. She started her love for holistic medicine in vet school, and after 9 years, she started her own mobile holistic clinic, the Divergent DVM LLC. She has a CVA from IVIS and is certified in Chinese veterinary food therapy. She received her graduate diploma from CIVT and has also become a certified veterinary aromatherapist. In 2018, she finished her master's in Iridology program from the Trutini School of Natural Health. And she is also a Reiki master and completed the PIVH veterinary homeopathy course in 2018. And she is currently working towards her certification. She has taught courses on suicide awareness and feels that you're never done learning. And today is also her birthday, so we can wish her a happy birthday at the end.
Thank you very much. And again, as in the first lecture, I'd like to thank our students. They will be our colleagues very, very shortly. And so we need to support them as much as we possibly can. So if you weren't in my last lesson, I wanted to let you know most of this is in my notes. If it's not, just tell me and I'll email you the PowerPoint presentation. But the PowerPoint is more picture forward because this is a very picture forward topic. So we already went through that. We're on the vessels. So you may be thinking, well, what do the vessels have to do? They're outside of the iris. Well, they mean a lot. And I'll actually show you a picture of a few of them with a case later on. And so we have different types of vessels coming up to the iris. So a couple of those. Let me find my notes. So the trauma fork, that's this one. So fork, trauma fork, indicates there's trauma or tumor in that region of the iris that it points to. So it's pointing towards this region. So this is around our head, neck region. So there will be trauma in this region here. So I would almost call this one a trauma fork down here. It's a little difficult, but usually they're more just straight and pointing right towards the actual site. This is a meandering vessel. So your meandering vessels indicates that there's weakness in the veins. Your vessels should not look like this. They should not be just meandering like that. It means that we've got some sort of a blood or a weakness issue going on within those veins, and we need to look at the circulation. Our next one is vessel pools. I don't have a picture of that down here, but it is what it states. There's a pooling in the vessel, so it almost looks like a little blood clot in the area. And our pooling is usually that we have a danger of a hemorrhage or an aneurysm, and it can indicate it where it's pointing, or it can just indicate it in general. So our tangential vessel goes along the iris. So this one's kind of, if it wasn't a trauma fork, it's almost a tangential vessel, which means the same thing because it's pointing to this area of the eye. So it means that there's an issue in that adjoining sector. So there are different sectors that we kind of looked at because it's a clock face. And so if we have a tangential vessel here, this sector has an issue. So these are spindles. Spindles are a little different. It doesn't look like a pool, but it almost looks like the vessel widens in areas, almost like a string of pearls, and it can indicate liver issues. It means that we're not in TCVM, we would almost go with it means spleen issues because we're not holding the blood in the vessels the way that we should. So that holding power is our spleen power. Also, our liver has to deal with a lot with blood, and so we have that issue that way. And then there are more vessel types. There's spiral. Oops. Whoa. Go back. Thank you. All right, so there's spiral vessels. They can mean different things. There's a lot of different ones that mean different meanings. These are more important. And then the other vessel that, remember, we talked about was our cardiac sign. And that's where, there's not in this picture, but it's a little like pink vessel that actually is on the iris that goes near the heart region. And that is indicated that we might have a heart attack issue or something to do with that in the future. So there's that. So next, all right, this one, I'm gonna not read all of these because every single one of these has something different to do with it. And I know I put in my notes a little bit more about what they can do, but you actually have to look at the pupil and how it's positioned within the eye. So we all know, that we have some differences with anisocoria, but we have the eyes where our pupils are maybe a little bit more elliptical or slanting in one direction versus the other. So a vertical ellipse, this one's very, very important because you can have impending cerebral hemorrhage. So if you see someone with this in their eyes, they need to go to the hospital. They need to get an MRI. They need something done because we have impending cerebral damage. Some of these other ones, so a horizontal ellipse isn't as bad. It's more glandular disturbances, things to that nature. Our frontal diverging eclipse is anxiety. There is a little bit of a tendency towards cerebral hemorrhage in this one as well. So really, if they're kind of vertical ellipses pointing straight up and down, or if they're diverging out to the sides, those are very important ones, and we need to look at the brain. Mainly, these are just kind of going down in the list. Left or right obliques is usually left-sided or right-sided paralysis issues. You can see these in some of your back patients that have issues with paralysis on one side versus the other. Sometimes they mean genitourinary issues or sexual organ genitalia issues as well. And then the other side here is flatness. So I'm going to go back to this one. I don't know if you guys can tell, but there's a little bit of flattening here. And some of these are hard to see. And there's a little bit of flattening on this side here. So instead of it being completely round, we have this little flat area there. And right here, we have it more at the top. And so those can indicate differences. So that would be, I think we have a frontal flatness on one side and a superior temporal flatness on the other side. So your inferior temporal flatness, so if it's flat out away from the nose, you can have another tendency towards cerebral hemorrhage. So those are things that we need to look at. You can have some weakness in your arm and shoulder areas. This one has more to do with like your thorax, so T1 through T4 vertebrae. In the iridology, a lot of our nerves and our issues along our spine correspond with our pupil shape. So you'll see that quite a bit. A lot of these have different things with pupil shape. So inferior nasal flatness is more sacrolumbar. So thorax, sacrolumbar. When we get down here into our superior flatnesses, you've got your cervical vertebrae, which makes sense. It's pointing up towards the top, that's cervical. These are pointing down, lumbar and thoracic. Our medial and lateral, you're looking more in the C to T delineation in between. And your lateral, you can have nervous breathing, and sometimes you can have respiratory collapse. And what makes sense is where these are pointing is our lung region on each side. So those are both sides of our lungs, so we have some lung issues there. These are a little bit harder to delineate. It's not something that you're going to be looking at too much, but just know if you see one of these, you may want to look up, hey, what does that flattening mean? What does that ellipse mean? And a lot of the times it has to do with circulatory or with your spine. Most of it is. If not, I can email you guys. I think most of it is. Yeah, it is. All right. So this is kind of my part 2. Go ahead. Nope. The question was, is the flattening or the ellipse as strong as it is in the pictures in most of the things that I look at? No, it's not. If it's really going to be imminent danger, it's going to be more pronounced. But if it's more along the lines of they've got some nervous issues in that area, it's going to be a lot less pronounced, like the picture that I showed before. So we're going on to part 2, and I wanted to kind of get into animals as much as I could, but we're still looking at the same lesions that we talked about in the last hour. We're just extrapolating them to animals. So this is the equine eye map, and you can find this online too. This is just one of them. I actually have a book on it that you guys can look at later if you want. But it has more of the ellipse. And then I'll talk about this portion right here, which is common just to horses. But you have your wither and shoulder area. You're still going in the same sense of this is dorsal, so this is your head and brain. This is your feet and hooves and your kidney. And you're still going to have things on one side that maybe aren't on the other side. So liver, I know that we don't have gallbladder in horses, so you're not going to find that on there. And it's a little less on the brain scale. It's just more brain, senses, fear, and balance. It's not broken down as much as a human would be. So this is a horse eye. And so you can see here, and it's actually highlighted down here, but there's a darker lesion along the outside of the iris. So this is the pupil, or the inside of the iris, the outside of the pupil. And it's darker in this area here. You can see it better there. That correlates with the colon. So obviously horses are more colon than they are anything else. So we have a lot of lesions that go in that area. So this horse is having distress in that area. We're also seeing up here stress lines, which are contraction furrows, which I'll talk about a little bit later, that indicate that the horse is under a large amount of stress, possibly due to the gastrointestinal issues. Right here, we have kind of where this colon comes around, but there's like an outcropping right here. That is our pelvic flexure. So that's part of that. And then we have our pelvis as well. So that's right in that area as well. Our pelvic flexure is actually up here. Our pelvis is down here. All right. So horses have something different than anybody else does. They have a granula iridica. So the granula iridica actually formed so that horses had something to block the light coming from up above into their iris. So it's actually kind of an awning of sorts. And you'll hear people talk about it as the horse's awning in their eye. And what it is it's actually kind of like a fingerprint to each horse. Every horse's granula iridica is completely different. So you can look at a picture and go, oh, I know that horse, just from their granula iridica. So this is pretty normal. They can be all different sorts of shapes and sizes, but they're normal. That is a normal finding in a horse's eye. You find this in a cat's eye, screaming melanoma. But, you know, or some sort of a tumor. But this is completely normal in a horse eye, and actually on this horse's eye, it says normal granula iridica. It has contraction furrows, so this horse has problems. I just found this picture on the internet, so. But it can be used to, like the texture actually will get different as the horse ages a little bit, and so it can vary with their health, age, and the care of the horse as well. But most of them have, like, you know, if they're born with like 3 lobes, it's going to have 3 lobes. It's just going to look a little bit different texture-wise. So this might be a little bit older of a horse, just because it looks a little shaggy down at the bottom there, whereas this one is a little bit more fine. Oh, This is a good picture though, because this is from the side. So you see how it sticks out like an awning, and it actually covers the light coming in from the side. So. Horses have different colors of eyes. There's actually 4 different colors. And really, for all intents and purposes, the only reason that we look at the color of the eye is how hard it's going to be to read that horse's eye. They don't have anything based on the colors right now, as in this horse does this more, this horse does this more. I mean, you could technically look at it as the horses with blue eyes have more of a lymphatic constitution. They might have more of the skin issues, more of the lymphatic gastrointestinal issues, whereas the horses with the brown eyes are more of the hematogenic. But we've got our beige eyes, blue eyes, brown eyes, and this is the best picture I could get of a black eye, and it actually has a little bit brown on the bottom, but you'll know a black eye when you see it because you're like, I can't read this eye. It's black eye. Like, even if you take the best picture ever, it's just gonna look black. Unfortunately, that's what you have to deal with in those. A lot of the times with those, I'll be looking at more of the vessels and the vasculature and where it's going towards that iris. So the one thing that you need to get out of this lecture if you treat horses, or if you have horses, is if you see this white line this is outside of the nutritive zone. So it's actually where you're gonna meet your collarette wreath, pretty much. That indicates that it's the mesenteric artery. So this is a green kind of dye in that area. And what it means is that your intestinal system is challenged. So you could have parasites in that area, you could have colic, you could have some sort of an intestinal obstruction. It just means that your gut is something you need to really, really focus on. All right, so the next little part here, and we have already talked about this before, are our stress rings. So there's stress rings here. This horse has so many stress rings. I don't want to know what it's gone through in its life. And then, so those are contraction furrows. They mean that the horses are under a lot of stress and tension. So you're going to see this in a lot of your show horses. And it may not necessarily mean that they had anything done to them wrong. Maybe that horse is just a very, very stressed out horse in their environment. And we need to do some relaxing methodology with them. Maybe they need some aromatherapy. Maybe they need some diffusion. Maybe they need to be in a different field. Maybe they don't like the field of work that they're in. I do see this a lot I work on a track, so I work with standardbreds. I see this a lot with my standardbreds. And quite frankly, a lot of them are cared for better than I am. They get treats and everything every day. They get 9 million baths a week. And all they have to do is work for 2 minutes on a racetrack, and then they're done. So a lot of them are very, very, it depends.
They're stuck in a stall for like...
Most of mine are turned out all day. Yep, all of the ones that I work with are turned out all day long. They get grass fields and everything. They're really taken care of. Like most of the tracks, yeah, I understand that, but most of them are turned out. If they're not racing, they're turned out all week. So, but they have a lot of these cramp lesions with them. Also the radius solaris. These are coming out, you can see them here. They're actually coming out from the edge of the pupil through the nutritive zone. That's a big one. It just kind of sits there and comes right up through. And those usually indicate parasites. They usually indicate issues in the gastrointestinal tract. Now, I mean, most horses are gonna have parasites, some sort of a load. This may indicate that they have a load that's way too much for them. I mean, they're constantly eating grass, they're constantly picking these things up. We know that they're gonna have a little bit of a load of parasites, that's normal. This indicates that they have more than they need. There are natural ways to deal with that, not chemicals. All right, so another thing that you're gonna see on these horses are these pterygiums. So pterygiums, and we can see these on humans too, as well. We'll see these in a lot of humans that live in more of a sandy desert type environment because they're usually from trauma and dust. Usually they don't go away. We see them a lot in different things. In humans, sometimes they can indicate that we have a fat metabolism problem as well. They'll pop up. But in horses, usually it's more trauma and dust type lesions. So really, we only look at that as to say, Maybe we need to get this horse out of this dusty environment. Maybe we need to institute something to, combat a drier eye. Maybe we have some liver blood deficiency going on or something to that extent. All right, so another thing that we see in our horses, and I know it's called Cushing's here, equine metabolic syndrome, some sort of a syndrome with their adrenal glands. If you look here, we've got, hold on a minute. I have this in here somewhere.
My book.
We have the canine. Right here is the adrenal gland. It's really kind of hard to see in this picture, but see that white, bright lesion there? That's the adrenal gland, and it's highlighted pink below it. So that's right here. So it's highlighted in this pink lesion. So if you see that, you might want to look at a metabolic issue with horses. A lot of the time, that means that these horses have poor nutrition. They're being overfed grain. They need to be on a higher quality hay, more forage, something that's more natural to them as opposed to the high carbohydrate load grain that we've been, feeding them. And then this here is, I believe that's the thyroid. Sometimes I have to look at these. Oh no, that's the spine. This horse has a spine issue. Thyroid sits right in here too. But if you look right here, there's another darker lesion there, and it's highlighted down here. That's the adrenal gland as well. So you've got these are two different horses. So you've got two different eyes and different adrenal glands showing up. So that's something to look at. So canine and feline grid looks almost, oh, go ahead.
Can I just ask about the you mentioned medial canthus, but that looks like that was lateral canthus?
It can be in both. Usually it's in the medial canthus. Yeah, this is just a weird eye. But usually it's in the medial canthus. In humans, more so, it's in the medial canthus. No problem. So this is our canine and feline grid. It's a little bit more in depth than your horse is. And sometimes you can actually find a feline grid that has your eyes in the orientation that your feline will have them in. I mean, we all know that cat pupils just look different than dog pupils. So still, you're looking at your nutritive layer around the outside of your pupil, your transverse colon, your descending colon, your small intestines on both sides. You still have your autonomic nerve wreath, and you can still see exactly the same things that we talked about in humans. We can see, our angle of Fuchs, a very, very raised nerve wreath that looks like a mountain ridge around the outside. Can indicate that we have some metabolic disorders such as diabetes mellitus. We can have pituitary issues. We can have your forebrain and your pineal gland. Those are all broken out a little bit more on the dog charts or cat charts versus the horse charts. Your thyroid as well, and it's still the same clock-based structure there. You're still seeing your heart more on your left side. You're still seeing your hind legs and kidneys down towards the end. Especially you have your genitals on both sides as well, ovaries, testes are on both sides, but your liver and your gallbladder are showing more on your canine feline on the right side. But if you look here, there's a little tiny bit of liver on the left side and spleen. So you still have that liver, of course, it transverses over the center line. You're still having a little bit of it there, but your spleen is more predominant on your left, whereas your liver is more predominant on your right. So you're just seeing that difference in organ structure from side to side. Also, we'll talk again, but this chart I love because it has the scurf rim around it, and I think next couple of slides I'll talk about that as well. Yep, here we go, the scurf rim. So this is zone 7. And I know we mentioned this before in my dad's eye pictures, but we see this a lot in animals because we have tons of skin issues and we have tons of liver blood deficiency and yin deficiency and everything from feeding these dry carbohydrate laden foods, and we're not getting them enough nutrients to their skin to be able to use it as an eliminative structure. And so the outer zone of the iris is zone 7. That is your skin zone. And so if it's dark and nasty looking like this, we have poor skin cleansing ability. And we have poor ability to rid the body of the toxins that it needs through the skin. And so what you need to do in these cases is we need to look at nutrition. We need to look at proper hygiene, how to help them out skin-wise. I know we had a few very good lectures on how to work on skin issues in animals. We need to figure out naturally how to get their skin to be able to release those toxins a little bit better. A lot of the time, we have animals that have been on tons of heartworm preventative or flea preventative or topical soaps and harsh things that are actually contaminating their skin. And so we'll see this lesion even darker on those. So if you see, and I see a lot of people that say this, like, oh, my dog's eyes are so cute. And I take a look at them. Well, the reason they're cute is because they're popping up so well because they have this dark band lesion around the outside of them. And you're like, oh my gosh, your dog's skin is awful. Like, please don't do that. So this is something that you can look at pretty well. This is actually an anxiety tetanic eye. So that's what we talked about in the earlier lecture. You see these cramp rings, but it's also very, very densely structured. So it's got a pretty good constitution. I wouldn't say this is strong, because we do have a few lesions here and there, but it's a pretty strong constitution.
So cramp rings, the delineations between each zone that are common?
They're not really delineations between each zone. They're actually just nerve cramps. So they're where the eye kind of cramps up in itself. They look like delineations between the zones, but really you should not see any delineation between the zones except for zone 2 and 3, which is your autonomic nerve wreath. So this right here, normal delineation. That's your autonomic nerve wreath or your collarette. These out here, not normal. They should not look like that.
So you shouldn't have any concentric rings.
Should not have any concentric rings. Those are all cramp rings, contraction furrows, or stress rings. Yes? The question was, if you see a dark zone on zone 7 or a scurf rim in an animal and you look at their skin, are you always going to see lesions? And the answer is no, because they may actually look like they have very good skin, but as holistic vets, we're also trained that what looks like on the surface is not exactly what's laying below. And so you want to look at their paw pads. You want to see if they've got that fine Corinthian leather on their paw pads, because I don't think I've found an animal that has it yet. And when they have that, that means that you don't have like a liver blood deficiency or a yin deficiency. So most of the time we're seeing animals that, even though their skin looks normal to us, we're going to be seeing fine flake dandruff. We're going to be seeing, even maybe when they're stressed out, they've got fine flake dandruff, which means that they have some sort of a liver blood deficiency or a blood deficiency going on. A lot of our animals see that. We see that with. Now, if we've got an animal that's been fed an amazing diet, be it raw or homemade from birth, and they have amazing Corinthian leather paw pads, and we see this scurf rim, then we need to be looking at maybe something hereditary in the line, that they might have skin disease down the line if they weren't being treated so well. So it can mean something a little bit hereditary as well, which is why we use this more as a tool rather than a specific diagnosis.
Well, but I know this is a nutrition lecture, but a lot of my clients who are feeding a raw or a homemade diet are not balancing it.
Oh yeah,
So
no,
I see a lot
yeah.
of really.
Yeah, that's why I meant an amazing diet that's like raw or homemade. It has to be balanced because, heaven's sakes, the worst diet in the world is an unbalanced raw or homemade diet. I mean, I would rather them be feeding kibble than an unbalanced homemade or raw diet. Oh yeah, yeah, no problem. Definitely needs to be balanced. And I have fights with my owners on that one. So, all right. So this is just kind of a chart to go over. It's just a great picture, and you can find this online. I know it's really kind of small, but Right here, you can see there's a collarette. I mean, literally, you can find this online. Just look up, chart of iridology lesions. There's different things that we didn't talk about. There's crypts here. There's what if one eye is different color than the other eye. All of these things have different meanings, and it's really hard to fit that into 2 hours. So it's just something to keep looking and keep trying to find different things. And the main point that I want you guys to get out of these lectures, and we'll look at some other animals here in a second, is look at your pet's eyes. Look at your friend's eyes. Look at your eyes. Take pictures. Send them to other people that were in this class. What do you see here? What's going on here? Look it up. You may not be a master iridologist. That's fine. But try to look up these lesions yourself and see, maybe you have a case that obviously has issues going on, but you cannot pinpoint it. This is another diagnostic tool to have in your back pocket. Oh wait, this is a good one of radial furrows too. So you can see it almost looks like a sunshine. That indicates parasites or gastrointestinal problems, pockets, something to that extent. All right, so this is a goat's eye. And actually, I took all of these 2 weeks ago at the fair because I knew that these animals were gonna have lesions because it was the very, very last day of fair and they had been stressed out for a whole entire week. Great opportunity for eye pictures. So this goat randomly in the pen, I have no idea whose goat this is. It actually has gastrointestinal issues and it actually has a lesion. Let me see if this is the right one. Yeah. This one has lung lesions as well. So see how dark it is over here? A lot of the goats after our fair, it's very, very dusty at our fair. It's very long, weak. We have open barns, so it's not as bad, but they're all confined with each other for a week. So we get a lot of upper respiratory issues after the fair. We call it fair cough. And so this goat has some upper respiratory issues as well because it's a very dark lesion in this side of the eye. And if you guys can see, I mean, you see these, this is all in the gut region. The question was it showing any symptoms of respiratory? I have no idea because I only saw it for 5 minutes to take this picture. And it did not cough while I was doing that. More than likely this goat will break out with a cough when it gets home. So. The question was, would you see changes in the eye happen this quickly? And my answer is yes. And if you look back at Dr. Von Igsley, or I can never say his name, Pesley, he actually saw the owl with the broken limb, and that lesion formed almost immediately with the broken limb. So you can see these lesions pop up fairly quickly within 24 to 48 hours. Healing time, they may never go away. They may take longer to go away. They may be very minute, and if you're not looking for them, you may not see them at that point, but a lot of them can pop up rather quickly. And it's just because our brain is the eye is an extension of the brain. So whatever goes to the brain that quickly is going to go to your eye. This is a pig's eye. I didn't see too many lesions. We've got a little darkening and maybe a little bit of a acid ring, which is pretty typical for these pigs because of how they're fed before slaughter. This is not my son's pig. He doesn't have blue eyes. But the white part here is delineated from a darker nutritive ring. I just wanted to take this picture because usually you don't see pigs with blue eyes. So this was a little bit different, that he has pretty blue eyes. He also has a lot of scurf ring around, so that's why his eye looks cute. So he probably had some skin problems. A lot of these hogs, this was of course after the show day. This was right before they left for slaughter, and I won't get into that with anybody. But they've been bathed quite a few times during the week, and they can also get into fights with other pigs in the ring. So they might have some skin issues going on as well. And these pigs grow so fast that we don't do a lot with their skin. And so they sometimes have a little bit of skin issues as well. So that could be why. So this one, I didn't see too many lesions. I just wanted to show you guys some pictures of different eyes. So these are all from fair animals. So we've got rabbit's eyes up here. We might have a little cramp ring right there in this rabbit, but he looked fairly content. They seemed to be fine throughout the week and do pretty well. And we didn't have a lot of heat this year, so that was good. And then this is a turkey's eye. So it's hard to take a picture of a turkey's eye when they're trying to eat you. But these are my cell phone. These are pictures of my cell phone. So you can use your cell phone to take pictures of the iris and get fairly good diagnostic quality. I do have a camera that I use that you can buy online that hooks up to a computer, and you actually put it over the eye and take a picture that way. And it kind of eliminates your light issues, which I'll show you some light issues in the next couple of pictures. Obviously, I had light issues here. You can only see the bottom of the eye, and light issues here. You can actually see my hand and the phone. So that's a problem. This is a chicken. So we have irises in the chicken. You can diagnose chickens that way. This one has a little underactive stomach ring. It's a little darker in that area. So he probably doesn't have as good a digestive function as he should. And this is a meat chicken. So he was probably fed very quickly to gain that weight. This is a steer. And this steer was literally walking onto the trailer to go. And he has contraction furrows. So he has stress furrows. This is one of the smaller steer. So I'm wondering if our heat this summer in our area got to him, because I know the owners and I know that they raised him as well as they possibly could. But with heat issues, heat is stress. You know, everything is stress. Parasites are stress, heat is stress, showing is stress. It's all just kind of stress for these animals, and we try to do the best that we possibly can to make it as less stressful for them as we can. So, but these are pretty good contraction furrows here with the lighting that I had. He had really pretty lashes. This is a horse that I work on. So her name is Red. She is a 30-year-old, aged Morgan. She does have EPM. She has arthritis. She has issues. We have 10 minutes. She has lots of issues. I think I'm almost done anyway. So she has a few contraction furrows, which I have no idea why, because this horse lives a heck of a lot better than I do, but it's probably just from her diseases that she has stress. She gets a yin deficiency diet of carrots and cucumbers and all this other lovely stuff, and apples and oats and beet pulp and whatever we can do to keep her yin deficiency in order. And she gets the finest quality hay, and she's never ridden and turned out all the time. So she does have some issues, though. You can see that her iridica granulata, this is the same eye. See how very much of a fingerprint that is? As well as this eye. This is her right eye. So in her left eye, she has some kidney issues. So there's some kidney markings down here. She also has some pelvic and back issues down there. In her right eye, she has some neck muscle issues, which are, it's hard to see on here. It's easier to see on my thing. She's got some neck issues. She's got some other issues in these eyes. She also, I mean, she definitely has an aging change in her cornea, or in her lens as well. Yeah.
I have a question about the top right picture.
Mm-hmm.
So if you see an iris that looks like a pretty dense iris, like a strong constitution, but you see those big holes that are almost at 12 o'clock and 1 o'clock,
Right here.
where it seems as though you can see right through them.
I think that's my lighting.
I've seen irises like that.
Right.
Where it looks as though it's pretty dense, but yet there's a space that appears as though you can almost see right through it, like there's a separation.
The question is, if you see areas like this, which I think this is a lighting change, but that look like you can almost see through the iris, there are degenerative changes that happen to the iris itself. Sometimes that can be an aging change. Cats can get degenerative iris issues, iriditis. We can't overlook the fact that we can actually have inflammation of the iris itself that doesn't pertain to any part of the body. So we do have issues that way where you have degeneration or holes or things like that that we need to look at. Yep. So this is actually my friend's eye. So I just took this as we were waiting for him to go into surgery. So it's not the best quality picture. You can see my hand with the phone. But he actually has some issues. He is a veteran, and he has a lot of skin issues from his 4 tours in Iraq. And so you can see he's got a very, very dark scurf rim. From his tours in Iraq, he has severe PTSD. So he's got some pretty good nerve cramp rings, very dark here. He also has some gastrointestinal issues, so he's got some radial furrows and some crypts in this area. So he's also got, if you look right here and right here, he's got some crypts in these areas, but in his right eye, that is the nasal region. He had nasal polyp surgery, so he has a nasal issue there. And he also has some tangential vessels here. So if you look, there's a vessel running right along here. This is the neck region. He's got severe back issues from his tours. And he's got, I think he had a forked vessel somewhere. Where did it go? Oh, right here. He has a forked vessel in this eye, pointing to some of his cramp lesions in this sector here. So you can see a lot of different things. I mean, there's tons of stuff on his eyes that I'm not going to touch on because it's just way too much. But just in 5 seconds with my cell phone, taking a picture of his eyes in the waiting room for surgery, you can see all this. And I think that's really the end. So I just wanted to give you some other eyes. This is a capybara with a blue eye. This is an octopus eye. You can diagnose an octopi. There's a binturong. I love binturongs. They're my favorite animal in the whole entire world. There's some eyes. This is a goat with a bright blue eye. I've seen goats with amazing blue eyes. Usually they're lymphatic constitution and they have issues. You know, of course, your cats, you have your different pupil there. I think that's the end, yeah, okay. So we'll leave it on this. So, questions, inundate me. We've got 5 minutes.
Cat eyes, I mean, there's a multitude of colors, so
Yeah,
it isn't just brown and blue and red.
right. Yep. The question was, since cat's eyes or other animal eyes have a lot of different variations in color, do we still look at the brown versus the blue? And we can't really until more research is done on that. You can usually extrapolate if they have blue eyes or if they have brown eyes, that they might have those issues. And we can extrapolate the fact that usually most animals have some sort of a combination of blue and brown. So even if you're looking at your amber eyes, your hazel eyes, your black eyes, it's just more of a combination of that blue and brown. So I tend to go and just, if it's a different color, kind of call them that mixed biliary constitution. But with animals, it's harder to delineate with the eye colors. So.
Any changes if you have a cataract removed, and would there be any residues or things that might be?
Would there be, the question was, would there be any changes with a cataract removal? As you saw in my dad's eye with the glaucoma surgery, you do have that laser lesion there. With my mom's eye, she has had cataracts removed and the lenses put in, and you can see just a little line where the surgery was. So it's just there. It's a scar tissue, so you just kind of have to overlook that. So.
Can you talk about that the heart vessel line? Do you see that in cats and dogs at all when they're depending cardiovascular disease, like you get a cat? Do you ever see that, or a dog that has a murmur?
The question was, do I ever see the cardiac vessel, the indicator vessel in the eye for animals or cats, you know, with circulatory issues? I have not seen it, but I haven't been doing iridology on pets for as long as I would have liked to. So I'm assuming that you would be able to see it in there. And what it looks like, and I couldn't find a good picture of it because it's not something that happens a lot. And it's literally a little raised pink line that goes over top of the cornea. They're very hard to see, but it's something that you need to be looking for, so.
You choose nutrition based on the color of the eye, since that's their, they have a tendency towards those kinds of diseases?
The question was, do you choose nutrition based on the color of the eye? And yes, you actually can. In my notes that I have over there, it states, you know, if they have a blue eye, these are the things that they need to do. They need to walk on the ground more and be grounded, because they need their electromagnetic field, and they need to eat. There's different things with humans, you know. This color eye should avoid coffee, caffeine, and over acid substances. This color eye should avoid fats. There's a lot of different structures with that too. So, any other questions?
What about the freckles and orange cat eyes? You mentioned earlier.
The freckles, the question was, what about the freckles in orange cat eyes? They are lesions. They are usually lacunae that we're looking at a lot of the time. I mean, you can have different colorations, and I know we didn't talk on heavy metals and things, but you can have heavy metals pop up in the eyes. I know with one of our founders that the quinine and iodine changed the color of his eye from blue to brown. You can have arsenic compounds that color the eye, iodine compounds that color the eye. So a lot of the time, those orange cats have been on a lot of medications throughout their lives, and so we may have those freckles coming up from a medical or chemical standpoint that are popping into the eye. We may have them as lesions or lacunae that we need to look at. Also, I mean, you can't overlook the fact that we can have tumors of the iris and things that we need to look at that way. But most of the time I'm seeing that they're lacunae or crypts. So, yep. Anybody else? The question was, what about animals who have lipid deposits in their eye? We do have a lot of animals with lipid deposits. A lot of the time, all that does is obscure the iris from us to be able to see it. There's things that I didn't talk about, though. There's actually, it's called I can't think of the name right now, but it's a string of pearls around the outside of the eye that is a lipid issue or an issue with fat. No, it's on the iris. Yeah, it's actually I can't remember the name of it for the life of me at the moment. It's more in humans, but it looks like a string of pearls around the outside, and that is a lipid deposit issue. Like I said, the pterygium can also be a lipid deposit issue, as well as your trauma. We can have that arcus sinalis that I was talking about in my dad's eyes, which is that white lesion around the outside. That can tend to be an issue with fatty deposits and lipid. But most of the time, the actual lipid deposits, any blood in the anterior chamber, that's just masking what we can see with the iris.
I've noticed in a lot of my patients, eye color change is very dramatic. And my own father, before he passed, he had very dark brown eyes, and they started becoming bluer and bluer around the rim, and that's why we need to see that closer towards that. That was after about a 3-month period. And in myself, I had a very difficult pregnancy, and I didn't realize this was happening until later when I started looking at pictures. Not only did my hair color change, but my eye color changed, and I didn't even notice until somebody pointed out to me I had a hazel eyes. I never had a hazel eyes until after that pregnancy. So how much does, is that a deficiency state when you started using or lightening your eye color?
Well, our time is up, but the question was really quickly that does our eye color change based on our health, maybe pregnancy, maybe an illness, a lifelong illness, and it can. What it means is, yes, you're seeing different varying layers of the iris, and so it's changing color that way. It can also mean that we have a lightening or darkening due to the amount of toxicity that's in our body as well, that our body's trying to get rid of, because all of those zones are trying to get rid of their own type of an issue. So we do have a darkening or lightening that way. So, yep. Thank you guys. Thank you.
Finding your visibility in today's climate with website creation, hosting, SEO and social media management, telephone greetings and VoIP services, and online video production.